retiree, this boost takes their monthly check from about $1,838 to over that $2,000 mark. That's an extra $2,400 a year. For someone on the minimum benefit, it's an even bigger deal. We're talking a 21% increase. And for a married couple, that's almost $5,000 extra every single year. This is real, tangible help that shows up in the bank account right away.
So what can you actually do with that extra money? I mean, $2,400 a year isn't just some number. It's freedom. It's the freedom from having to make impossible choices. It could mean finally affording to go to the dentist. You know, getting cleanings, fillings, maybe even new dentures, which has a huge impact on your overall health. It's getting new glasses so you can actually read a book or see your grandkids' faces clearly. It's the start of an emergency fund, so a flat tire doesn't turn into a total financial disaster. It could cover your whole utility bill every month or a big chunk of your groceries. It's the difference between being stuck at home and actually having the money to travel and see family. That's what we call quality of life.
But hold on, because the Social Security Expansion Act has another piece to it. It's a little more technical, but over the long run, its impact could actually be even bigger than that flat $200 raise. It's all about how your benefits keep up with the rising cost of living year after year. Okay, so right now, the annual cost of living adjustment, or COLA, is calculated using something called the CPIW, the asset limits. They have not been updated since 1984. Seriously, think about that. For 40 years, a person on SSI couldn't have more than $2,000 to their name, or they'd lose their benefits. This proposal raises that limit to $10,000 for an individual and $20,000 for a couple. This is a revolutionary shift. For the very first time, it allows people to actually save for an emergency, to put money aside for a car, to get to the doctor, or to handle a leaky roof without being terrified of losing their only source of income. It's a move from forced poverty to actual financial empowerment.
But there's another piece of this SSI puzzle, and it's a particularly cruel one. It's something called the marriage penalty. The way the rules are set up right now, the system actually punishes people on SSI if they decide to get married. A married couple
huge
gets
change is happening with Social Security right now. We're talking about a 40-year-old problem that's finally being fixed, and it means billions of dollars in payments are being sent out as we speak. So if you've ever worked as a public servant, a teacher, a firefighter, a police officer, you need to listen up. We're going to break down exactly what's going on, who's getting paid, and what you need to know. Okay, let's get right into it.
So here's what we're covering. First, we'll dig into the 40-year-old problem that started this whole mess. Then, we'll talk about the Fairness Act that finally fixed it. After that, we get to the good stuff, the details on your retroactive back payments and the permanent boost you'll see in your monthly checks. And we'll finish up with the most important piece, what happens now and what, if anything, you need to do.
All right, first things first. To really get what's happening, we have to go back in time. See, this wasn't some new glitch in the system. It was a decades-long policy that was actively reducing the benefits for millions of hardworking people.
So the big question is, how did this even happen? I mean, why were millions of public servants, people who dedicated their lives to our communities, watching their earned Social Security benefits get slashed, sometimes for their entire retirement? Well, the answer comes down to two very specific and very controversial rules.
Yeah, the culprits have names. The Windfall Elimination Provision, or WEP, and the Government Pension Offset, GPO. These rules were put into place way back in the late 70s and early 80s. Now, the original idea was to stop people from double dipping. They didn't want someone getting a pension from a job that didn't pay into Social Security, like a lot of teachers or firefighters, and also getting a full Social Security benefit. The government called that a windfall. But what it did in reality was just penalize people for their public service. It cut the benefits they had absolutely earned from other jobs where they did pay into the system.
And this wasn't some small niche issue. The scale of this is just wow. WEP and GPO affected roughly 3.2 million people. Think about that. For more than 40 years, millions of retirees saw their monthly checks shrink. And for many, it created real financial hardship and a deep, deep sense of unfairness.
Okay, so we've laid out the problem, this long-standing injustice. Now, let's pivot to the solution, the landmark change that has completely turned this thing around.
This right here is the game changer, the Social Security Fairness Act. You know, after decades of people fighting for this, a new law was finally passed, and its mission was simple and direct. Completely get rid of both the windfall elimination provision and the government pension offset. It literally just wipes those unfair rules off the books, for good. So how did this all unfold?
Well, the act got through Congress in late 2024 and it was signed into law on January 5th of this year. But listen, the most important date on this entire screen is retroactive to January 2024. That is huge. It means the law doesn't just start from the day it was signed, it actually reaches back in time. The Social Security Administration started sending out payments on February 25th, and they're saying all the really complex cases should be sorted out and paid by early November of 2025.
All right, let's talk about the part you've been waiting for, the money. Because this law is retroactive, the Social Security Administration has to make things right. And they're doing that by sending out these large, one-time lump sum payments to make up for all the benefits that were wrongly withheld. And the amount of money we're talking about is just incredible. So far, the Social Security Administration has already sent out over $15.3 billion in these back payments, and they're not even done. The acting commissioner, Frank Bisignano, said there's about another $6 billion that still has to go out to everyone who's waiting. So what does that mean for you, personally? Well, on average, the typical one-time retroactive payment comes out to $6,710. Now, of course, that's just an average. Your payment might be higher, it might be a little lower. It all depends on your specific work history, but it gives you a really solid idea of the kind of money we're talking about here. So you're probably wondering, how do they even figure out this lump sum? It's actually pretty simple. Let's just run through an example. On average, people were losing about $360 a month because of WEP and GPO. Well, the law is retroactive back to January 2024. So you just take that monthly amount, the $360.
Today, we are going to get into something that really hits home for tens of millions of people: Social Security. But look, this isn't going to be some dry lecture about spreadsheets and trust funds. We're going to explore a completely different vision for the future, one where financial security isn't just a far-off dream for seniors and people with disabilities, but something they can actually count on. The ideas we're covering today could mean a total transformation, not just in bank accounts, but in peace of mind, and health, and in simple human dignity.
So here's what we're going to cover. We'll start with the big picture, the vision. Then we'll break down 3 major proposals: a $200 monthly boost for everyone, some huge changes for SSI, and a plan to make sure the whole system is secure for the long haul. And then we'll put it all together to see what the real combined financial impact looks like for different people. Let's dive in. All right, first things first. It is so easy to get lost in all the numbers, the percentages, the names of these different acts. But we have to remember what's really at stake here. This is not just some accounting problem. It's all about the human side of these policies.
And this quote just hits the nail on the head. You know, behind every single number we're about to talk about, there's a real person, a senior who's trying to decide if they should buy groceries this week or pay for their prescription, a person with a disability who literally can't save a dime for an emergency because they're afraid of losing their benefits, a couple that can't get married because the system would actually punish them financially. So as we go through all the details, just keep this idea in your head. This is about letting people finally breathe a little easier.
Okay, let's get into the first big proposal, the Social Security Expansion Act. You've probably heard about this one. Its core idea is super direct, really easy to grasp. It's all about providing immediate and widespread help to every single person who gets a Social Security check. So the heart of this act is a $200 a month increase for every beneficiary, straight up. But what does that really mean? You know, a flat $200 has a very different impact depending on where you're starting from. So let's look at the real numbers for real people. For your average individual retiree, this boost takes their monthly check from about $1,838 to over that $2,000 mark. That's an extra $2,400 a year. For someone on the minimum benefit, it's an even bigger deal. We're talking a 21% increase. And for a married couple, that's almost $5,000 extra every single year. This is real, tangible help that shows up in the bank account right away.
So what can you actually do with that extra money? I mean, $2,400 a year isn't just some number. It's freedom. It's the freedom from having to make impossible choices. It could mean finally affording to go to the dentist, you know, getting cleanings, fillings, maybe even new dentures, which has a huge impact on your overall health. It's getting new glasses so you can actually read a book or see your grandkids' faces clearly. It's the start of an emergency fund, so a flat tire doesn't turn into a total financial disaster. It could cover your whole utility bill every month or a big chunk of your groceries. It's the difference between being stuck at home and actually having the money to travel and see family. That's what we call quality of life.
But hold on, because the Social Security Expansion Act has another piece to it. It's a little more technical, but over the long run, its impact could actually be even bigger than that flat $200 raise. It's all about how your benefits keep up with the rising cost of living year after year.
Okay, so right now, the annual cost of living adjustment, or COLA, is calculated using something called the CPIW. The big problem is that index tracks what younger working people are buying. It doesn't really get what seniors actually spend their money on, and for them, a much bigger chunk goes to healthcare. So the proposal is to switch to something called the CPIE, the Consumer Price Index for the elderly. This one is specifically designed to track senior spending. It gives a much more accurate picture of their costs. And what that means is a slightly higher COLA each year, usually about 0.2 to 0.3% higher. Now, I know that sounds tiny, but just wait. Let's see how that little change builds up over time.
And this is where you see the magic of compounding. Let's say we have a retiree who's getting $2,000 a month after that $200 boost. Okay, fast forward 10 years. That tiny little difference in the COLA formula means their monthly check is now $72 higher than it would have been. Now, let's go to year 20. The difference has grown to an extra $181 a month. And when